Hello, everybody. Welcome to another episode of My Take with me, Mabi. Today program we will talk about health. So when I talk about health, I mean now how your body they feel. Means how your body be fine where you don't need doctor or you don't need any medicine for you for the taker. I think that's what I mean by health. So I want to talk today about things that we fit do for prevent say we not get disease wey we fit go for doctor. So wetin I wan talk about na holistic medicine, the other part of medicine. So when you combine holistic medicine with the medical medicine, they call it integrative medicine. So holistic medicine na for prevent you first for get any disease. Do healthy habits that will go prevent you for get any disease for go for doctor. And who be Mabi? So me, I be a nurse practitioner. That one means I get a master's degree in nursing. I specialize in acute care nurse practitioner. I dey take care of people dem wey they dey for hospital for intensive care units. So wetin the special area the way I don work. I don't take care of people the way they dey for medical ICU as they call am for here. The one that they get lungs disease, they get kidney disease, liver disease. I don't take care of those kind of people there for ICU. I don't take care of people the way they get disease wey affect their GI, means this part wey you chop, then go down so that you go for toilet. I don't take care of those people the way they get problem. I don't take care of people that they don't get transplant. Transplant will give you new liver if your old one don't, if your liver wey dem born with them don't spoil. Man wey wan die, if he talk say I wan give my own organ for some person, make it they can live with them, you transplant those organs to another person. Liver, kidney, pancreas, heart, lungs. I don't take care of those kind of people there for ICU. That's transplant. I don't take care of people that they get open heart surgery. They don't open your heart, they fix them. Maybe you don't get chest pain, they call MI, or heart attack, they fix your heart. I don't take care of those people then. I don't take care of those people the way that they put them for machine way, that they give the machine all the care, that they take all your blood, run them in a machine, it work for you while you recover. They call an ECMO machine. I don't take care of those kind of people. And finally, the last specialization, what they take care of them are people the way the brain. So man way you don't get stroke, maybe from hypertension or any other problem, or man way they don't open the brain, the surgeon don't open them, fix the brain inside, or man way get back pain and they do surgery for a back, or those kind of people there. Now people them way I dey take care of them. Now my current specialization that. Today we not dey talk about medicine. That one we dey come up for doctor. We go give you tablet for swallow, or if they operate you or so. I want to talk about how you feel prevent yourself from reach down that road for be for hospital. Why I choose this topic? Me, I go through that situation. After I don't work for medical profession, for all the specialization the way I name them for you, I finally find out say me myself too I dey need medicine. Where I get to go for doctor, make it give me medicine. I go tell you my own story. But I will go first for tell you what to be the topic. Our topic today, I name am wellness. Wellness is intentional. Wellness. What do I mean by wellness? Now for practice habits, day-to-day habits, where it will prevent you from go for doctor in office or for go for hospital. Thing the way you fit do, the chop them way you dey chop. Your exercise wey you do am, the physical thing the way you do am, your stress level the way you dey do, wetin you fit do personally like that person for prevent yourself so that you no dey go for doctor. Believe me, plenty thing that we fit do for prevent we for go for doctor. And I go talk about those things we dey minimize am, then na the thing that wey dey make we sick, and then we dey end up for doctor door. When they say intentional, why I use that word intentional? I use that word intentional because healthy habits them, people them think say na only for take medicine. When you sick, you get fever, go for doctor, give you tablet, you begin to take am. Most of those medicine they get side effect. When he give you one, you take medicine, fix this one, you spoil another one. Take medicine, fix the one, spoil another one. Intentional, now wetin you go do deliberately for prevent yourself, make you not dey take medicine, for prevent yourself, make you be healthy. When I be dey talk this story, or when I don't become, I dey do this holistic medicine, and I be dey discuss, because I love the topic and I like to discuss with other people then for see whether I fit help other people then. I discuss am with some of our community people then, some man for the population, for the people that I dey talk with them. He put his hand down, up, not down, up. He talk for me, say man get to die for something anyway. And I say, talk, man get to die for something anyway. So now my answer this what I be giving. Death, an easy thing. When I mean easy, means say death not be good thing. Not be say death not something when you die, then people then glad or so. I mean, so when you don't die, your problem don't finish. It's gone. No more money problem, no more health problem, no more anything. So death is easy. Your problems are gone. The problem na disability, not be death. When you don't get hypertension, you get stroke. Your one side skin don't die. You dey for wheelchair every day. People that help you for wake up, people that help you for wash, people that, and you live for the next 10 years, that's miserable because you dey struggle. When you don't get that hypertension, then your kidney don't spoil, and then you dey go for dialysis machine Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, all those things, 3 days a week. The day like you not get life again, because now you get to go spend your how many hours every day for sit down for chair. That's disability. Which are they try for talk na say we could prevent disability, we prevent things that we go make your life difficult. And then talk about preventing death, because if you still prevent, do all the good habits, you still die for accident. And talk about preventing disability. I think I'll be talk, so that you live a healthy and thriving life. So wellness get 4 dimensions. When I say 4 dimensions, you talk about spiritual wellness, that good feeling. When I talk spiritual, for religious person means say your relationship with God. For a non-religious person, say just a relationship with yourself, your well-being. Emotional wellness, where you not spend time stress, anger, all those kind of things. Physical wellness, I talk about disability, where you not be disabled, you not go for doctor office, you not take no medicine, you be fine. Now physical wellness, that. Social wellness, the one where you feel interact with people freely, you see the struggle, back pain or headache, all those kind of things. Those are the dimensions of wellness. So I will go now for talk about emotional, physical wellness destroying a home. And I will talk about this story, so that we start understand when I talk about you feel prevent yourself from go for doctor office, then you start understand the things that we do, we make we end up for doctor office. Your environment, we talk. So we talk about your environment, your physical, your social, and those kind of things. The things that we do. So I be again make this discussion for some group when some couple dem be dey for the way their life be so miserable way they be dey look into divorce, the husband and the wife. And this one na their story. The husband get chronic back pain when they take medicine, oxycodone, that medicine wey dey put you to sleep all the time. Most pain medicine will put you to sleep all the time. So all they do is spend the time na sleep. The woman get chronic headache. We eat 2 day for doctor door, e dey take medicine all the time. If you see relationship between those two, wetin dey happen, the man with chronic illness cause a wife a chronic headache, or the wife a chronic headache because the man a chronic backache. Emotionally, they dey share the disease. So the wife, the madam, na nurse, e dey work night shift. So e dey go for night, go work, come back for during the day, dey sleep. A man be being a nurse, but he be don change, he be na IT, they call am technology. So he dey work na for house. He get computer dem wey he dey work every day for house. So e start na say this man, as he dey work for house with this computer, he start get back pain. As he start get back pain, he go for doctor. My back dey hot. They do x-ray, they do all kind tests, they give you pain medicine. He go take the pain medicine, he dey sleep most of the time because of the pain medicine. And because he dey sleep most of the time, he no get good time for take care of his own self. They get 2 pikin dem, no man no dey wey dey look up pikin because madam dey come back from work from night duty, headache, he dey sleep, massa, he dey sleep. So pikin dem dey play, throw dirty, toy all over the place. The man, each time wey he go for doctor, the back pain dey worse, he dey go, they dey give him more pain medicine. Each time he go, they give him more pain medicine wey dey make him worse. So of course, because he no dey do anything, na so he don big too. He get a job wey dey work only for house, na so he don fight. He don big. Wait, as he don big so, wetin he get again? Sleep apnea. He dey snore for night over. So madam don drive you for bed. He say, I dey come for night duty, I no dey fit sleep because you dey over snore. So he don go form him own room wey na for there he go sit down, wey he go do, he go dey sleep. So he dey sleep na for that room. He get about 3 computer dem for that room. Na for there he dey work and na for there he dey sleep. So the story, as they tell me how they want divorce, actually tell me and my husband. So I said, maybe I go see Usa when I stay, so that I go see how I feel help Una for this situation. So I go visit them. The first thing when I walk, they get a very big, nice house. As soon as he opened the door for the house, I noticed the first thing. No window no be open. Despite the fact say them be their house a few minutes ago, all window, every place be locked. I asked him, so how's the be we locked? He said, well, now they rarely open the windows because I be so busy and madam today always sleep, so I be so I know they hardly open windows. So the number 1 problem that we already noticed, and just as I walk through the house, these people they get low levels of, what do they call it, serotonin. Serotonin is your happy chemical. Your body they produce serotonin so that it keep you happy. They call it the mood stabilizer. How you get serotonin? Serotonin is through light. So serotonin will be produced during the day. A chemical will be produced during the day. So now how? Through light. So when you're there for your house, even if you never go outside, open your windows so that light will stream through the windows. You can get serotonin. The best way now actually to go out for a walk. 15 to 30 minutes under the sun. And no need for explain this. We all know say during a winter, depression be very high during winter. Now one of the reasons of that. So you need for open all windows every day. Mind the open window, bikini open your window. May light that coming, bikini go out go work. As we get inside the house again, all this clutter of things and from picking them, they through cargo. Now one of the other problem than that, we like for buy. House be cluttered. A beautiful house, now house will not be cluttered. You don't need all those things. Anything you don't need them, why you just so buy more? So now, next thing that, keep that house where you don't get clutter. I go things them all over the place. I will explain again what I mean by this clutter. So I walk into a bedroom, I ask this outside the sleep, I walk into a bedroom. 3 computer screen them for a bedroom. He said, why you wear computer screen them for a bedroom? He said, oh, because it be easy with the back pain, so it be easy for you to just get up then sit on the computer. So you see, he get a job, which may be a nice job, maybe a bad job, but a job to kill him. You know, not saying a job to kill it, but a job to kill it. 3 computers for bedroom. He said, no. That computer they get to be now outside the bedroom. Reason, LED lights. Most of we will get TV then for our bedroom. Bad habit. Because most of the time when we go, we turn on the TV, we watch a small program. LED lights, they prevent you from get a very good deep sleep. Once you don't watch that LED light, when you go back to sleep, you start toss on the bed, so you don't get good sleep. Computers should be all downstairs. That TV, then when you wake up, TV should be downstairs. Computer, the way you wake up, play down. Then they also make you not sleep. Third thing, that chair where you should for day. You know, get chair way it is supported back. It's the specific chair for shidong on top. You need for, if you get that kind of job, invest in your health by say you get the chair way is support the job where you stay for house. Support your back. You not get those things for day. Madam your own problem. It work night shift. It come back in sleep all day. So it miss sunlight. If you really come, it sleep part of the day, wake up, maybe go walk a little bit or so. Then it expose itself to having serotonin. So thy own problem that it get headache because the environment where they did it be very depressive. Them too they be depressed. It get the back, it get the headache. So what will be the solution I tell these students? So going quick to the story. Solution. When I open window, lots of lights. Every morning wake up open window. When I pack house, find some room where when I fit throw all that clutter for inside. So that space then be. Remove that computer and make sure so I go for that house. We find another room, they get a big house, put all that computer for the reason, make it roll over from a bed, try worker at least. For go for the other room. Than for just roll over. You not even brush teeth, you just go for computer, go shoot them for the. Or that inactivity, you not be the helping. Number 2, emotion. So I don't talk about the environment. Number 2, emotion. So I will talk about the fact say they know they get serotonin. So I advise them they must go outside. They need for take things like vitamin D, especially vitamin D3. Especially because they sleep inside house most of the time. Or they go take it naturally for outside. Vitamin D, I will recommend vitamin D. I will recommend cod liver oil. I think most of we know cod liver oil. Made them take it. And then I will recommend magnesium for the husband. Chronic fatigue, most of we take zinc. But not only they take zinc, when you know they take copper. Because zinc depletes you from copper. So if you're taking a lot of zinc, you must take copper. Omega-3, make you take weight loss. Then you don't overput weight. For if for not to get the sleep apnea, because it is snore, you need for lose weight. I will talk about this weight loss thing. You have to be healthy to lose weight, not lose weight to be healthy. Because people they misunderstand it too. The difference. Stop for chop late for nights. I notice small chop all over the place, a chocolate bar, all those things them. No. Stop for chop late in the night. Last meal 6 p.m. bedtime 10 p.m. So we talk about sleep. No work for nights. Go for bed for 10 p.m. so that you sleep. Posture. We will look for a better chair where if you maintain a posture for the chair so that it will help with your back pain. And that alone, those things alone will not solve it because it already developed the problem. You need to do some exercise. And the exercise will be suggest for you now, yoga. Invest in yourself. Go register for the class or Pilates where you feel straight your back so that they pull that back for you. Believe it or not. Then talk for madam. I want to leave the party. I forget to talk about madam. When your husband be start feel better, we know they take this pain medicine again. He be a lively man. Her headache went away. You know they complain again. My head. So the headache was a reflection of the situation we did for house. Maybe because if I have that, forget that headache. The back feel better. The wife they smile now, and they get a good environment. You see, not be medicine solve this problem. I just change in their habits. It solve the problem, and they be happy now. So I begin to talk this example for now, so that we understand what you are trying to talk. It sounds simple, but it will work. So we will talk about modern lifestyle killing me and you. Modern lifestyle killing me and you. So I don't talk about how me too are for the medical field. So I don't put on so much weight. I don't be big. The next thing doctor tell me I say, your sugar then, they don't be high. So you get type 2 diabetes and you get to start take medicine for diabetes. Before that, I don't take medicine for hypertension. No, I don't take medicine for hypertension for the past 10 years. I take medicine for hypertension. Before doctor can add, say I get to take medicine for diabetes. The next thing, one day, I go to some tests. Doctor tell me, say, it look like you get plenty fat for your liver. And I be very worried about that. That was the last straw. After I leave that doctor office, I come for house. I was miserable. Because now they take medicine for blood pressure, I take medicine for hypertension, and then now they talk to my liver is sick. So I start doing research. What you have to do? Now for there I start holistic medicine. We mean say, take care of yourself, disease that will go away. So now for there that my journey starts. I start follow holistic medicine, the things that they suggest that we go talk about as we go through this. Now 1 year and some months, I never take blood pressure medicine. And I know they talk like that. Sometimes people they say, I know they take medicine, but they know they check. I check my blood pressure. My blood pressure will be perfect. 110 high, the top one, 120 the top one. That's it. I not take medicine for blood pressure. I not take medicine for sugar. My blood sugar be perfect. That medicine them all I be don't throw them. That liver way doctor be tell me I go repeat test for the liver, what they call it MRI, where they take picture for that liver. I get call for house where doctor do want know whether I my picture that because he not be fit believe the picture. I say, yeah, na me. He said, what you do? I said, I just changed my lifestyle. He said, unbelievable. Whatever you're doing, keep doing it. Now the answer that he gave me. So I be so impressed by the fact that I'm not taking a medicine. I just change things about my life. And all these diseases go away. Anytime my friends they know me for work. That's how they talk about. That's how they talk about. I actually go see my gynecologist. I think 2 months ago, I instead become like the doctor for your office. All man don't surround me and they talk about what if you do so that you not get sick. Because I don't like the topic. I like for talk about all my here for understanding. So me I be end of obesity, hypertension, type 2 diabetes, fatty liver, which all I do, I change my life and it go away. So I feel I need for share that information for all man for understand. Modern lifestyle is killing us. What is that modern lifestyle they do? They chop the way they chop, the habit the way they do, the thing the way they do. It don't cause you forget diabetes, hypertension, stroke, heart disease, cancer. Some cancer they now they be related to the lifestyle we choose and for do. And if we change the lifestyle, we prevent ourselves from getting cancer. The habit that we do, excessive consumption of processed food, mobile phones, inactivity, all those things there. Things and then we fit you for change these things. And we will not just assume say this thing then they now modern life, what you would do. No. We they make the choices on those things then. And when we make the choices, then when that sick comes, then we get to follow doctor, then we take that pill. We get to make the choices intentional for not enough for doctor, the office or for hospital. I talk about the disease again. I say obesity, diabetes, stroke, cancers. Now the lifestyle that we don't choose. You will see that picture. You see that hamburger? Big hamburger. Now the thing that now will be chopped. Easy. That's one. Fast food be easy. All you do, you just drive your motor, stand for some window, point picture. They bring them for you, you chop them. It's killing you. It's easy, but now it kill you too. Fast food, refined food. You see, in fact, sometimes they say 4 pieces, 4 level of meat, refined meat. We did it. Now, those foods are killing us. The modern food. Next picture will show more of the chop them. Pizza, orange juice with the wrong refiner, Coke. See all those things and for that table, those are all refined food. They call them ultra refined food. Fast but deadly. What else? The kiwi, death by comfort. I just talked about that man inside bedroom when I been talking story. Comfort. Roll over for bed, just go for a computer, do work, they pay you, but you don't know say that same job now it is short in a life. Death by comfort. Most of we will not do anything, sit only on TV, play with phone, talk for friends, inactivity. Death by comfort. Another term wey they call all these diseases and what they talk about disease of civilization. A few years ago, 20 years ago, when cancer be for the European world and the Western world, cancer plenty. They send some researchers and made them go to some of the Asian countries. Africa will be one of the continents where they be send researchers and maybe they go find out why we will not get cancer like them. Yes, 20, 30 years ago, we didn't have as much cancer like them. They go find out why we not get cancer. You know what they find out? The reason is because we know we don't start chop them with the chop them. We be the work farm them for our backside house. We all man don't give them up now. All man don't give up farm for backside house. They sweep now backside house. Leave they don't fall, they sweep them. Instead for plant jama, instead for plant small cocoa. Now thing that way white man be find out. Say because we will be the work we are farm them for backside house. We are jama for backside house, we are cocoa for backside house. We dey chop natural foods, not refined foods. Thing wey white man be find out again na say we will be the drink now, we are natural drinks them. We will chop mango, we will chop we are orange. We not the chop na that one where they don't squeeze and refine them before they give way. We are chicken that be grow for front house. We kill and we chop on natural chicken. Remember the Fulanis them with their cow, then with the worker from one town to another. They chop the grass. Now it will be the chopper. Natural meat. So that one may keep cancer away. Surprise? What will they do now? China, they send we all this chicken where they don't fluff them, sometimes don't put chemicals them so that make them they bloat up so that it big so that you will buy them. Tell Mamina say, oh, I don't go kill fowl. He want that China one. Because that China one soft. Now that one is kill them. Full of chemicals. They don't breed the chicken them. They grow within 2 weeks. They don't make them grow so fast. They give them chemical. They grow so fast. You think that they give them that chemical, then you chop and where the chemical will go? Only in your body. That's the thing than that. Meat, cow that they grow within a few months because they don't put chemical them for inside the cow. May grow fast, grow big, and so cow fat. Also you think that chemical go not for your skin. Fish. Now everybody they rear fish. They grow their own fish for backside house. Fish was not meant for us to grow it in the back of our house. If you want to grow fish, natural pond with the flow. The fish then eat natural things for day. Nobody the one would give them chemicals, antibiotics, all kind of things. The fish they grow big, so we take them, we burn them, we chop them. We some things say they go for your skin. So when we be give up our habit for the chop that natural things when we are mommy them, they be the ground for backside house. We then become like the Western world. So in the Western world, main man way it dey for home, nothing say they be excluded. When I say man for Ambazonia, may nothing say be excluded. Because now the thing that we the chopper now. So wetin happen? After 20-30 years of the study, they send person back for Africa for go find out wetin happen. We don't be like them too. Cancer, liver cancer, prostate cancer, lung cancer. So we don't be like them too. Because for us, we like to copy everything with the Western world do. Right now, if man dey work in backside house, I think they dey look it think say foolish. Wey that thing dey for store cheap. No, that person dey work in backside house, he dey do wellness is intentional. He dey take care of himself because he no dey chop those chemicals dem again. You see, I just talk about simple thing dem wey you fit do so that you no dey go for doctor. Those chemicals dem wey dey chop am. So disease of civilization that I don explain am for you. Na this disease from this fast food dem wey we dey chop am. E dey cause heart disease, cancer, type 2 diabetes, hypertension, obesity. All that chemical dem wey dey dey put am for that chicken and for that cow, e dey enter we. Na so we to the blood, we dey get big. We get obesity, we develop hypertension, sleep apnea, all those diseases dem. Cancer. So, causes of metabolic disease. So now we get to the meat of the story. Now wetin dey cause this disease dem? I don hit on them as I dey talk. 4 main things dem dey wey if you intentionally change how you dey do those 4 main things, that's I mean if you dey do them wrong. If you dey do them right, keep doing it. But if you do them wrong, change am. 1, diet. You chop wey you dey chop. 2, stress. Any man dey for this Western world know how much stress dey cause so many diseases. Stress dey take a toll on your body, and stress na dey cause almost most of the diseases dem. I will relate stress on how dey cause disease, and you go surprise. Sleep na one thing wey people dey always ignore am. People dem think say sleep na just a luxury. Oh, na some if you sleep, you get time for sleep, fine. If you no get time for sleep, fine. No, sleep no get to be ignored again. Enough sleep dey prevent a lot of diseases dem. Hypertension, heart disease, cancer. Sleep dey prevent them. You will surprise. Exercise not necessarily mean say go for gym, jump. No. If you no fit afford for go for gym, your simple day-to-day walking is exercise. Walking in your house is exercise. You get people that dey sit down for chair from morning to evening, and yet the house need cleaning. If you put am for your head, say just to clean that house na some form of exercise, I think it go help you. First, it go keep your house clean. Second, you don exercise a little bit for that day. Important for keep moving. You get to keep your blood circulating. So, 4 things for prevent you for the go for doctor office or for hospital. Diet, the food you eat, stress, sleep, exercise. I'll talk more about that. We get some other things and we dey do and we are choices. That one, you either give up the habit or you kill yourself. Smoking. That one a habit wey go kill you, lung cancer. Alcohol get how to fit up. Alcohol no be something where they say you must give up alcohol. Alcohol na a socialization medium. Alcohol in moderation. Me say if you be that person where you don't dey drink you all the time, create a habit where you make a certain day, na day wey, oh, today I fit drink my wine. Maybe since you dey go for meeting every once in a month on a Saturday, why not make Saturday your day where you fit drink 1 glass of wine or 2 glass of wine? That's it. Make Saturday your day to drink. Not to drunk, in moderation. You no need for the drink every day, every day, every day. That's not moderation. So alcohol no be bad thing, but na how you limit your alcohol, because alcohol na it dey destroy your liver. Too much alcohol, liver get to do with alcohol, and when e don overwhelm it, e go die. Your liver go die. Drugs, man, when you do drugs them, I be tell you how oxycodone dey make that man dey sleep sotey e nearly destroy life. Then what more of cocaine, marijuana, and all of that? That too will kill you faster. Those ones are choices, but the ones them way you fit prevent yourself from go for doctor, we will talk about that. You see pictures of the next picture of processed food. You see all that hamburger, pizza. When I say processed food, we're talking about diet. How diet dey kill me. Most of we don't be so lazy for cook. You say, oh, the life be too fast, so you know dey fit cook again for your house. So you dey buy Cheerios, put them for in front picking their face. I think that way they chop. What be the other ones them again? All those things the way they put that inside milk for morning time, fast, for give picking them and chop. And for there you start. Those are processed food. All the sugar wey dey inside that processed food. The next thing, we dey take them, run go with them for McDonald's, hamburgers, all of those things. Those are processed food. Processed foods, they be quick, they be fast, but you need for the eat natural food. Means say food where you do cook am for house. If I want take another step further, I will tell you organic food. Organic food is the preferred food for you for the eat. Means when I talk about people them for home, the one where you walk out for your backside house better pass that one the way you dey go buy them for store them way they come out they import them from outside. And if you dey talk for people that for diaspora, are the same thing. If you not fit afford organic food, that is fine. They cook your own food. You do well and you do better if you cook your own food than refined food. One of the problems with processed food is sugar amount for inside the food. So we'll talk about how sugar, now one of the deadly things and way that they kill we now. Sugar be the cause of most of our diseases them now we will develop them. Stress. You see that picture? For Ambazonia now the stress of which dey happen, the revolution and everything dey happen. For diaspora, money stress, workplace stress, road traffic stress, health problem stress. Be highly stressed. Now the reason that the Western world, especially America, has the highest amount of patients who are obese. Obesity be very high for America, may be related to the foods and our stress level. What do you do when you be stressed? You eat. Food stimulates the happiness center in the brain. So when you do chop, you think say you will feel better. But remember, when you chop finish, that stress will come back, that problem will come back. So food never ever stop stress. It will just temporarily make you happy because it stimulates the dopamine center in your brain or the happiness center for your head. So stress, you get to cut down your stress. Stress na the thing, next thing wey e dey kill most of we. Stress dey stimulate a specific hormone wey dem dey call am cortisol. So na some chemical wey our body dey produce am when you the chemical dey for our body, we suppose to use am when we be stressed. But when you be highly stressed, you dey produce a lot of that chemical. So you dey reduce the chemical. And the chemical will then cause another problem because you dey stimulate it for be produce a lot. So it get an influence on insulin, as I can talk about them later on. So that's how stress go do for you. Go make you big so. Signs of stress. You see, next picture. You not fit concentrate when you be stressed. People don't lose their job set because they be highly stressed. Difficulty sleeping. Most people don't know they sleep. Insomnia. Most people don't know they sleep because they take problem go down for bed. Roll. Again, then they wake up for morning time, like you talk. They just think say the day, oh well, I not be sleep last night. You just throw it out like that. Sleep, important for your health. No ever neglect sleep. Why I wind up? The next topic where we go talk about now about sleep. So I jump straight into sleep. Studies of sleep deprivation. National Library of Medicine study 2024. I put the website for the or the link for the. Lack of sleep has been shown to increase the risk of premature mortality. Lack of sleep will make you die quick. In a recent review of various surveys, it was concluded that individuals who slept for less than 6 hours each night had a tenfold greater risk of premature mortality than those who obtained 7 to 9 hours of sleep. Yeah, 7 to 9 hours of sleep. As you know the sleep, you dey shorten your life. May explain what the sleep mean. I will use religion for those who already believe in God. Obviously, we all get to understand why God make we more sleep. There was a reason God made us to sleep. For those who already not be religious, the chemical reason why you get to sleep. One, first, no take chop for your belly, go sleep. You get to eat your last meal 4 hours before you go to bed. Means the digestion don't finish take place so they don't pass before you go to bed. So, bedtime for most people should be between 10 p.m. to 11 p.m. So means your last meal get to be between 6 p.m. to 7 p.m. Chop don't finish. No more. No go open refrigerator door or go for inside kitchen. Go take chop. When you take chop for your belly, go with them for bed. Your body, the thing where they happen when you sleep, now say your body get that small thing the way they do for your skin, like small machine where they for your skin, where they repair, they fix your skin. So when you sleep, other activity there, everything what you do don't go quiet. That small chemical them come, they fix things the way they don't spoil. They build your body. That's the reason that man sleep. For rebuild, regenerate. So you wake up for morning time fresh. When you take chop, go with them for your belly and you sleep with them. That small chemical them, that small soldier dem wey dey be get to can repair your body, they no go fit do am because they get to walk on top that chop wey you take am go for your belle. Na so man dey. So instead for you for repair, they dey for belle every time for make that digestion. You wake up for morning time looking old, looking tired. You dey cut years and for your life because you no dey repair. Na the reason too that way you dey be exposed to illnesses because your body no be don put you new soldier dem wey dey be ready for fight any illness. You get only old soldier dem. Every night you no dey sleep, old soldier dey still dey. They no go be able for protect you when some disease dey. The importance of sleep. You no dey sleep, e dey cut years out of your life. Sleep deprivation. The general public often devalues the seriousness of insufficient sleep and may have a more general attitude that in the larger scheme of life's difficulties, not getting enough sleep occupies a fairly low rung on the step ladder of personal health concern. So wetin dem dey explain? We think say sleep no important. Sleep na down there. If man no sleep, come on, wetin? So if you no sleep today, you will sleep tomorrow. No, you don't. It no be like catching up. When you don't lose the sleep today, you don't lose am. I know you can make up by starting to do a good habit, but nothing say you no sleep today, tomorrow I no sleep the next day. I'll catch up after 1 week. You're losing something. You lose something. Studies don't show the significance of sleep to a health status. Very important. Studies don't be done about that. They say effect of lack of sleep. That people they don't put on that big weight. Sometimes it happen for small people, but most often we they call it sleep apnea. Most often are for big people. That snore where man is snore. That bad thing. That snore where you snore so means say air. So we dey breathe good air, we dey send out bad air. That's what man dey do. We breathe good air, we send out bad air. So when you make that means say that good air it dey find difficulty to go in. That good air not dey fit go in. So that old bad air na e dey remain for your skin. Bad thing. When that bad air remain for your skin for many times when you dey sleep, you no dey sleep complete, it dey cause you to get hypertension, it dey cause you to get heart attack. Where those things then they go lead to other problems. They cause your lungs. They call them pulmonary hypertension. It cause your lungs to get very stiff. So you will always struggle. So you move from sleep apnea to more sleep apnea to more difficult situation. So wetin prevent yourself make you no dey snore, dey struggle for sleep for night. Na bad thing. And you fit change that with wellness is intentional, doing the right thing, do the right thing way it will prevent you from even reach that level. Effect of lack of sleep. You see side effect of missing sleep, you say irritability, impaired judgment, all of those things. All right. We go to the other things. So I will name 4 things. I will talk about your diet, where I talk about your food, I talk about your stress, sleep, exercise, lack of exercise. This one a big one. Most people don't think say exercise and for go for gym. If you get money for go for gym, fine. If you like company, fine. Gym na fine place if you like company. You fit exercise for just go out of your house, go for a walk. Walk in your neighborhood. Walk for place where you stay. For back at home, not you always take taxi. This one too na another bad habit too. Don't practice am. Taxi for every place. Taxi. That waka wey we dey waka na good thing o. We don't give up so many of our good habits because we dey wan copy all the Western habit. For waka no be suffer. Waka will keep you alive for long because you dey exercise your leg, you dey exercise your heart, you dey exercise your muscles. Waka na good thing. First way, you no dey waka, you no dey do anything, wetin dey happen? You dey grow big, fat. When you go big, you get that sleep apnea, you get that hypertension, you get that diabetes, you get other things and wey you no go even like am. You see, as you see for that picture, this person na small pikin dem that. Even when small pikin dem, especially for this Western world now, they sit down only for chair, watch TV from morning till evening, chop dey only for their front. Mami no dey talk nothing, papa no dey talk nothing because e be easy for let the pikin just be so down, for the pikin for disturb them. Make a habit for take your pikin go outside una go walk. As a father, na a bonding time that with your child, or a mother, na time that when you and your pikin una fit dey talk. Come and let's go for a walk, like on a Saturday or Sunday. Una come or go waka, una go waka, come back before una make breakfast, before una chop. Create that habit so that the pikin dey start understand. When you don't make them don't start fat from the time when they're young, you don't start put that disease them for their skin. Believe it or not, pikin them for 12, 13 years, and now they get hypertension. And why they get hypertension? Now because of this inactivity, where they don't develop hypertension. Because of the poor chop we give them. We take them go all the time for go fast food, for go eat all this fast food. 13-year-old pikin, if you take blood pressure medicine, that's disastrous. You fit fix am. You fit fix am. For that 14-year-old name, fix am. Or else, again, no be death, na misery. Because you get to follow doctor all your life, you get to follow hospital all your life, and who knows which kind of complication will come out of this problem. I don't explain how this condition that I talk about, this condition, the way we need for fix am. But I will explain for now why this condition that they cause these problems. Simple. We get two things for your body where they be very important. They be important to us, but they be a disaster to us too. Insulin, cortisol. Two important chemicals there. We get more chemicals there for your body, but we'll talk about these two. The disaster where they fit cause some, and if you change your health, if you improve these two chemicals, insulin, cortisol. So, what be insulin? Insulin, you get your pancreas. It cause some small other organ or machine there for your left side, what they call as the pancreas. Now it secrete this insulin. Man need insulin because now insulin will help that chop will the chop. Now insulin will help for change that chop for that energy. They like car, petrol, it will help motor for drive. Glucose where we the chop, now it will help we for your energy, for waka, for breathe, for this talk what they talk. Now glucose. Insulin, now it will convert that glucose. It will take that glucose, it go send them, may they use them. Insulin now it will transport that glucose. Where they're going to use them for give you that energy. So when you chop carbohydrate, cassava, fufu, you chop meat, protein, you chop fat like oil, 2 of them, the carbohydrate and the protein. When insulin, when you chop them, they go then turn into glucose, and then insulin, the pancreas will send that insulin. Insulin are like messenger. So na messenger wey e dey carry that glucose for go give am for all your body. So e dey like na messenger. So when you chop, na how your body dey deal with the chop. That's especially more talk specifically like carbohydrate. Na how e dey deal with am. Your body go change am into glucose. This glucose, they go either take am, insulin go either take am, go give am for your body, make you use am for energy. I use the word power, for energy or power wey you go use am for do things dey. Or your body, if you get other glucose, e dey store am for your liver wey dey for your left side. E dey store am for your liver so that like time wey you dey sleep, you no dey chop, your liver go release that glucose for keep you going. So your liver na the place where when you no chop, na for the glucose go comot. Your liver go dey release am. The third other way na say insulin go take am, e look round, e no see place for do, you no need the energy, e go keep am like fat for your skin. So e dey keep am for rainy days, keep am the day wey you starve. So you get 3 sources for energy, for power. The immediate glucose wey go send am, insulin go send am for your skin or for your tissue. The second one na for your liver, wey if that one for immediate one because you no chop no dey, e go comot for your liver. Or the third one, e go comot from fat from your skin. So na the 3 way dem that. So when I say insulin, now we are fighting for your skin, but also can become deadly and bad to us. Now how? Okay. So my explain now. Insulin resistance. Now the next thing I will talk about. When they say again, insulin na dey help for sugar or glucose for your blood. Insulin na messenger. When you don't chop, the chop don't be converted to glucose, insulin will be secreted by the pancreas. Insulin will come now, come pick that glucose. It will take and go for the place where the glucose will be turned into energy. So it comes for your skin, they call it the cell. It comes for the cell, it knocked off for the cell. It say, I get parcel for you. When are the glucose? When you fit take and make your energy, the cell open the door. They say, oh, thank you. They take the glucose. They turn them for energy. 2 hours afterwards, you chop again. Insulin come, pick that glucose, go for that cell. Cock. Cell say, yes, I get another parcel for you. They say, oh, thank you for the glucose. They take them. 2 hours afterwards, you chop again. Insulin, I work that. After a while, your cell don't get too much glucose. What do you think say your cell will tell the insulin? Man, I get too much glucose for here. I not get use for the see the man. He just sit down for chair. He not even go no place. You want somebody to do it with him. I don't want them again here. Take them. So insulin, you don't remember that package. You say, hey, what you going to do with this package now? He knock that door again for the cell. The cell say, I don't tell you, sir, I get too much package for you. I don't need them. Go with them. Insulin get that package when I glucose. You don't know what to do. So insulin remember, oh, I get liver. I go store them for day. You go store them for liver. Next time you chop too fast again or too soon, you don't know what to do with the glucose. You go for liver. Liver say, I don't want them again. Where does he put it? So you say, I look around and say, "Wait, what you do with this glucose? You put them for your butt, for your buttocks. You put them for your hip. You put them for your belly. You put them for your hand." That's it. It deposit the fat. So you grow big and big and big. That's insulin resistance because your cell, they don't tell you, say, we don't want your glucose again. We get too much glucose. So you get too much insulin, it float around now with all of this glucose, but your cell, they don't want them again. Now you don't develop what they call type 2 diabetes. Type 2 diabetes means your cell, they don't reject insulin. Like, understand now? They accept only a few from the insulin, then the rest, it will just be around. So you don't become resistant. This insulin resistance, when you develop insulin resistance, now the cause of a lot of disease, that way it will happen. Cause of hypertension, diabetes, cardiac disease. For women them, especially for this country, they don't start develop what they call PCOS. Woman get PCOS, or woman they like say don't turn be like man. So you know if you be pregnant again. And sometimes it be caused by this insulin resistance. And until it change a habit, doctor they will only give you medicine, they call them metformin. They give you medicine where it is say make it force the cell them for accept insulin. So you go for doctor. Doctor will give you medicine where it will save, it will force that cell them for accept insulin. But they're already over be saturated. They will accept them, but your sugar will still always consistently be high. So insulin resistance, like I talk, diabetes, cancer, cardiac disease, multiple sclerosis, autoimmune disease, some the pain, joint pain all over the place, weakness, fatigue, tiredness, everything from just simple fact say you chop, your body don't start talk say, and no wonder insulin again. Stop. Okay, so we don't talk about that. Insulin resistance, a study that was put again by National Institute of Health. Another study that way they be doing. Insulin resistance caused by ultra refined foods lead to diseases. So insulin resistance be caused by this refined food and will the chop and I don't tell you about them. All the fried potatoes, hamburgers, all those refined food, pizzas cause insulin resistance, and how often you eat. Many of we will not even count how often we eat, because we chop a meal now, within 1 hour we pick up an apple, we chop them. Within the next 1 hour we pick up a chocolate bar, we chop them. Within the next minute we pick up all of those. They count and they will lead to insulin resistance. Too much familiarity. Your cell, they don't see that insulin too much, they don't want it again. How frequently you eat and refined food. See this study. So the study shows that if eating the ultra refined food consumption is significantly associated with incidence of obesity, increasing insulin resistance. So the more you eat, the more you become obese, and then the more the insulin resistance get worse. So you don't now on a loop, a cycle. You chop, you fat, you chop. So that cycle they continue. Cortisol, the other thing what we talk about. Cortisol, hormone of stress. So no wonder America has the highest amount of obesity. We are highly stressed in the US. Job-wise, finance-wise, that's money, work, traffic, the whole lifestyle. I know, Omo one come for America. You might be highly stressed. So, wetin dey happen with all this stress? We get a natural chemical, hormone, wey e own job. That hormone be produced na some small beans shaped thing wey dey on top, or not bean shaped, some small like a cap wey dey on top your kidney. They dey call am the adrenal gland. Some small thing, e just sit down on top of your kidney like cap. They call it the adrenal gland. Na it dey secrete this chemical wey they call am say cortisol, na hormone. The job for this cortisol na for take care of you during periods of stress. During periods of fight and flight wey you dey run around, we get some different chemical wey dey take care of you. Cortisol na chemical wey dey take care of you during period of stress. Mean say with life you suppose to get a minor amount of stress. But when you become too stressed, you dey overproduce this cortisol. One of the bad things with cortisol can negatively affect insulin sensitivity, which can lead to insulin resistance. So, wetin cortisol dey do too much of it again, e make you dey develop wetin I just talk about, insulin resistance. So, wetin be symptoms of high cortisol? High cortisol dey make your blood sugar high, so you end up with type 2 diabetes where you need medicine. High cortisol dey give you hypertension, wey dey make your blood pressure high. High cortisol dey make your bone dem soft, wey fit broke. Muscle weakness, mood swing, e dey instead make you be more stressed, more irritable. So again, another loop. You need cortisol, but then you don't make it don't be too much. So now you dey for loop. The higher the cortisol, the more stress you are. The more cortisol, the more stress. Wellness is intentional. How we fit do for solve this problem? We'll get different days and we will talk about different ways and we fit solve this problem. So for today, I will concentrate only on those 4 things that we are talk about: diet, sleep, stress, exercise. Limit processed foods. Cook chop for house. If you can afford organic food, buy them. The thing about holistic medicine, now say, when I say wellness is intentional, I try to say people then actually get to make some research on themselves too. Listen to good lectures, make a determination what to be good. Remember not hear this lecture now. You run go for internet. You see they talk for they say, oh, cook banana for kanda for banana, boil them, grind them, drink them, it will help with blood pressure. And then you jump into it. I don't see that video then multiple times. What I want some secret about that. I not disagree say banana no dey help for anything. The one thing I go tell you now, most banana them na plantation and they be sprayed with a lot of pesticides. They spray banana all the time for prevent the banana making no spoil. So they spray. So when you buy banana, you peel them, you eat the banana inside. That can protect the inside. But when you take that one way, that outside way, it contains pesticides. Cook them, you drink them, you're drinking pesticides. Be careful when people they say, this one they fix this one they fix this, and you just jump. from one thing to another. Wellness not be quick fix. If you been a quick fix, then just go for doctor, make it give you medicine, you take and you drink them. Now a habit we get to cultivate them. Limiting processed food no necessarily mean that you go cook some kanda for banana. It just means you limit processed food. We start from one thing, we find sugar. Scoop, how many scoops put that inside coffee? Sugar, not good. Especially if you drink coffee now with sugar. Your next meal you deal with chocolate. Your next meal you deal with something. Sugar. What did it happen? Insulin resistance. Limit those things. Intermittent fasting. A lot of studies, they don't show. Now say, if you limit how often you eat, you will decrease or you will prevent insulin resistance. So back to me. How have we come out of type 2 diabetes, prevent insulin resistance? I will cut down how often I eat. Because again, the often you eat, insulin is secreted. So you get to cut down how often you eat. You just start small. So if you will eat 6 meals, when I say 6 meals, don't think it's in a full meals. I mean, every time you see someone put chocolate, you pick up. You see someone put this, you pick up. Stop that habit. Make your meal something where you will eat anything you like in one meal like that. So start small. For breakfast, eat what you want. Till 12 o'clock or 2 o'clock when they are lunchtime, that nothing never enter for your mouth. Chewing gum, bonbon, whatever, never enter for your mouth, just water. You eat your lunch. So remember, no insulin. Only during breakfast, insulin. Lunch, you eat. Dinner, you eat. 3 meals. From there, you change. You go to 2 meals. Breakfast, dinner. Remember what I talk about dinner? By 6 p.m., 7 p.m., you don't finish your chop for night. You don't chop for morning time. 2 meals. That's so you reduce type 2 diabetes and you come out of the medication. The next thing, if this never bring them down, 1 meal a day. Choose which time you want to eat everything. I want chop meat, I want chop wheaty, fruits, everything. That meal, you chop them. You train your body for not to see that insulin again all the time. Your body will regulate itself. Your body will fix its skin. Now so I will do before type 2 diabetes go. And while I do want to so, I lose weight. I lose 55 pounds. Only way I do only this thing them so. I not go for gym, go the pool, cargo them for heavy things and for gym. I not do other one. I get a dog. I do work on my dog. So intermittent fasting means say cut how often you put things into your mouth. And sometimes the best way for do that now for take away so much of that food, excess food of things if you don't get self-control. We will tempt you. Limit refined food, intermittent fasting, limit stress. Stress na part of we limit stress. People they take problem go down for bed, you wake up the problem still there. Try to watch something motivational. We go teach you how to deal with stress. We go teach you how to understand say whether you go for bed you think about that problem till the cows they come home, or you keep thinking about that problem, it will not change. You will have to deal with it in the morning. I dey listen to a lot of motivational thinking where they help me. You get people that they talk to them way when you listen, you say, oh, that one makes sense. It dey help me for get things organized. Adequate sleep, we don't talk about sleep. You must sleep at least 7 to 9 hours in the night. 7 to 9 hours in the night. That should be a habit. The way me I do and I say, I put for my phone, I put my alarm for 10 p.m. So even if some TV program I dey watch it be so interesting, my alarm will ring, ching, 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 and I just know. And then I go turn it off, I go into bed. Sometimes it be difficult for you for change things, so you need certain things for reminder. So 10 p.m. I don't go for bed. I be even put an alarm for my phone by 6 p.m. I don't chop. 10 p.m. I don't go to bed. Exercise, like I be talk, I know we go gym. What I do, I get dog. I dey go walk with my dog for my neighborhood. Waka. If you don't get dog, if you find a friend, fine. If you don't find a friend, exercise a waka you want. And if you fit do, you prefer a gym, do gym. Supplementation. As we talk through this whole health thing, we will talk about supplementation. Especially when you go on an intermittent fasting, you actually need to take some supplements in. Important supplement, vitamin B complex. A supplement where you need them during the time where you change your meal planning. Vitamin D, K2. Vitamin D, especially people that they live for that cold area, them for Europe, them so. For Africa, when I dey for sun all the time. Vitamin D, K2. CoQ10. Omega-3. You need to take those simple things like that. Magnesium. Most of we, especially people that they get that hypertension, over the counter magnesium at 400 milligrams. You take them, it will help. Those are the simple supplementation the way you get to you take them, you drink water. It will help for prevent you from being sick, or it will help for improve your blood pressure. Ongoing topic them now we I dey go through as I dey read about holistic medicine and research. They talk about, can fasting reverse disease? Whether if you fast, it will reverse disease. I will say yes, because it reverse my own disease. It reverse my diabetes. It reverse my hypertension. It reverse my fatty liver. It reverse my obesity. Can it reverse disease? Yes, it can. Fasting, intermittent fasting worked for me. Gut microbiome. So your gut means that they talk about what it is for your intestine them and for your belly. They try to study the bacteria the way they did it. People that they take probiotics, prebiotics. They hear about all the new research and they talk how these bacteria they for inside our intestine them, how they help with too, and then we need for make sure so we get good bacteria there for our intestine. Until I've been listening to this part about gut microbiome, then I understand why when we leave from US here, we go home, diarrhea they want to kill you the first few days and when you reach for the people they used to think say, oh, not because place maybe no clean or so. No, the reason is because as we leave from there, we from home, we come over to America, we lost so much of our bacteria, the natural bacteria. So the one that we'll get them for you a different kind of bacteria them, and also all these refined food them we don't eat them, all this over cleanliness and we don't do and all that, we actually not even get the good bacteria from your gut. So when we go back for home, diarrhea they want kill because small dirty way go they start sick. So it's a little bit of bacteria in your gut, of the good bacteria, be good. It prevents illnesses and will keep you healthy. They talk of mitochondrial health. Now that one be a little bit deeper. And then longevity research, again, it be centered about what you do for prevent yourself from being sick. Diet, stress, limiting stress, sleep, exercise. You do those 4 things. I did it. It worked for me. Be intentional. We don't come to the end of this part of the program. I thank all man we go listen, and I thank the technical team. Goodbye.
Welcome to ACN.